Welcome back to the channel. We brought you very crucial info. We respectfully ask you to stay with us until the end of the video. I will announce the topic first. Supreme Court weighs landmark affirmative action cases with far-reaching implications for higher education. Biden administration unveils ambitious plan to improve health care affordability and access. Let's move on to the detailed news. Supreme Court weighs landmark affirmative action cases with far-reaching implications for higher education. In a pivotal development that could reshape the landscape of affirmative action in higher education, the Supreme Court convened on November 1, 2023, to hear arguments in two significant cases. The lawsuits, namely Students for Fair Admissions Incorporated v. President and Fellows of Harvard College and Students for Fair Admissions Incorporated v. The University of North Carolina at Chapel Hill, challenged the admissions policies of Harvard University and the University of North Carolina at Chapel Hill. At the heart of these cases lies the allegation that these prestigious institutions' admissions processes unjustly discriminate against Asian American applicants. Affirmative action encompasses a range of policies and practices designed to bolster the representation of minorities and women in educational and employment domains. These policies can manifest in various forms, including race-conscious admissions at universities, targeted hiring initiatives in the corporate world, and the establishment of set-asides for minority-owned businesses. The origins of affirmative action in American higher education trace back to the 1960s, a time when the civil rights movement exerted a profound influence on societal norms. The primary objective of affirmative action was to redress historical imbalances by enhancing the enrollment of minority students in universities, which had traditionally been predominantly white and male. Proponents of affirmative action contend that it serves as a crucial mechanism for leveling the playing field for historically marginalized groups, such as minorities and women. They argue that affirmative action fosters diversity within student bodies and faculty, thereby enriching the educational experience for all individuals involved. Conversely, opponents of affirmative action assert that it is fundamentally unfair to discriminate against any group of students, irrespective of their race or ethnicity. They advocate for a merit-based approach, emphasizing individual qualifications rather than considering race or ethnicity as a factor. Over the years, the Supreme Court has consistently grappled with affirmative action cases, shaping the legal landscape surrounding this contentious issue. In the landmark decision of Regents of the University of California v. Bakke in 1978, the court upheld the use of race as a consideration in admissions decisions while simultaneously prohibiting the implementation of racial quotas. Subsequently, in Grutter v. Bollinger in 2003, the court narrowly upheld the University of Texas's affirmative action plan, albeit through a plurality opinion. The Supreme Court is expected to render its verdict on both cases by June 2024. Should the court choose to overturn the usage of race in admissions decisions, opponents of affirmative action would secure a significant triumph, potentially leading to a decline in diversity across colleges and universities nationwide. Conversely, upholding the incorporation of race as a factor in admissions decisions would represent a substantial victory for supporters of affirmative action, preserving the opportunity for institutions to consider race as a component in their holistic admissions processes. As the Supreme Court deliberates on the pivotal affirmative action cases, the outcomes have the potential to reshape the future of higher education. With profound implications for diversity, equality, and fairness, these decisions will undoubtedly leave an indelible mark on the educational landscape, prompting institutions and policymakers alike to reflect on the delicate balance between meritocracy and the pursuit of a truly inclusive society. Let's move on to the other info. Biden administration unveils ambitious plan to improve health care affordability and access. In a bid to enhance health care accessibility while ensuring affordability, the Biden administration made a groundbreaking announcement on April 17, 2023. The newly unveiled plan comprises 4 key components designed to address the pressing challenges faced by Americans in securing affordable health care. Lowering prescription drug costs. The plan aims to empower Medicare to negotiate lower drug prices, establish a cap on out-of-pocket spending for seniors regarding prescription drugs, and enable individuals to purchase medications from Canada. Expanding Medicaid access. Efforts will be made to simplify the Medicaid enrollment process, granting more individuals the opportunity to benefit from the program. Additionally, Medicaid eligibility will be expanded to cover all low-income adults. Enhancing marketplace coverage affordability. the plan seeks to provide subsidies that make health insurance through the Affordable Care Act marketplaces more affordable for individuals. Investing in health care infrastructure, recognizing the significance of community health centers, rural hospitals, and other providers serving low-income communities, the plan will allocate resources to bolster their capacity. The Biden administration's overarching objective with this plan is to ensure widespread access to affordable health care for all Americans. By tackling issues such as exorbitant prescription drug costs, expanding Medicaid coverage, promoting affordability in marketplace insurance, and strengthening health care infrastructure, the administration aims to make substantial progress toward achieving this goal. The implications of the Biden administration's ambitious health care plan are far-reaching and hold immense potential for positively transforming the lives of millions of Americans. By reducing prescription drug expenses, expanding insurance coverage options, and enhancing care accessibility for low-income communities, the plan has the capacity to generate significant improvements in health care affordability and equity. While the Biden administration's plan is still in its nascent stages, it is expected to face opposition from Republican members of Congress. Overcoming this resistance will be crucial in advancing the plan's implementation. Additionally, the plan's substantial cost raises concerns about funding sources. The administration will need to address these challenges and engage in negotiations to ensure the plan's viability. With the announcement of an innovative and comprehensive health care plan, the Biden administration demonstrates its commitment to expanding access to affordable health care. By proactively tackling key issues such as prescription drug costs, Medicaid coverage, marketplace affordability, and health care infrastructure, the administration aims to drive tangible improvements in health care access and affordability for all Americans. While challenges lie ahead, the administration's bold vision holds the promise of transforming the lives of millions, ushering in a new era of equitable health care opportunities. These were the stories we had available at the moment. More information will be provided in a few hours. Remember to subscribe in the meantime.